interestingly enough, I think to start with the most important, fact that I pulled from it is 45% of men want to be bigger. But with this survey, again, 66% of men said that they were average. The size of the penis correlated with the height of the man and negatively correlated with being overweight.
Anything with shoe size?
No, but nose
Or
size.
hand size?
Nose size. 85% of women said that they were satisfied, and 55% of men said they were satisfied with their size. So women tend to be happier.
We're more forgiving than you guys think.
Yes, and I think that, again, it's probably more in what the skills are with all the appendages. Like, subscribe, share with friends if you like the content we're putting out. So welcome back to RevMD Podcast with me, your host, Dr. Deborah Durst, and Faraday is with me.
Hey guys, how are you?
So we're back, and we are going to talk about penis size. So does penis size matter? This seems to be a very important topic, and again, based on even surveys, it seems that this is something that men are frequently thinking of. And
are polled on and have very strong opinions on. Guys, we know we don't have the equipment. This is not our arena, but it is something that is commented on frequently, so we figured we should address it.
Yes, it's on lots of different forums. Again, it's on comments, and we don't have the equipment. And we have some thoughts on whether that matters. But again, because we don't have the equipment, we want to look at what can be done and what you men think. And so again, we look forward to comments on this one. So
don't trash us for having the video. Comment and open the conversation.
Correct. And like, subscribe, share with friends if you like the content we're putting out. So a survey, and again, this was about penis size, and a lot of stuff with sex is survey based. And so it's just questions of, population, either men or women. And this was actually men and women. And it was a survey of 52,000 heterosexual men and women. And interestingly enough, I think to start with the most important, fact that I pulled from it is 45% of men want to be bigger. So that's almost half of men are saying they want to be bigger. So that's important, right?
Well, when you think about women, 48% of women polled they
True.
don't like the way their vagina looks. So maybe this is just a trend across all genders.
Yes, like she's given equal time, and that's true. Like there was a huge survey, not quite as big as this one, but it also did a survey just of women, and it was 48%.
Unhappy. So maybe this just trends across all genders.
Yeah, so it was 48% of women unhappy with their vaginas. And again, I think I know why that is too. And we have, we talk to a lot of men and women each day. And so I think I have a good idea of at least what women think, but we wanted to hear what men think and what kind of studies are out there. And there was a recent study, which is what we want to get to today, on PRP and penis size. But with this survey, again, 66% of men said that they were average. And again, the size of the penis correlated with the height of the man and negatively correlated with being overweight.
Anything with shoe size?
No, but nose
or
size.
hand size?
Nose size. Like I saw, again, there's rabbit holes when it comes to
Of course, that's why I brought up the shoe and hand size.
There's countries. Did you find anything on the shoe?
You just hear it, that it correlates. Look at
Definitely.
their shoes, their hands, but I think it's all.
shoe size, it's forearm, and
our camera guy said something about a forearm.
Yeah.
I don't know.
I haven't
don't believe
heard that one either. But nose size does correlate with penis size, apparently. And again, we've heard, of course, yes, that hand size does. I don't know if that's the case. I didn't pull any studies for that, so I didn't see
anything on it.
No, I did see some data on nose, though. But
Which is
anyhow,
interesting enough.
Yeah. 85% of women were actually satisfied. So 66% of men said they were average. 85% of women said that they were satisfied. And 55% of men said they were satisfied with their size. So women tend to be happier.
We're more forgiving than you guys think.
Yes. And I think that, again, it's probably more in what the skills are with all the appendages than it is just with, the penis. So I think that's why women probably tend to be happier, because it really depends on how they use it, right? And
Oh, yeah.
so, but you
Like,
just
my
okay.
brain went 5 different ways,
That's
and I just figured the safest answer
I
was,
don't
oh, yeah.
think I ever got just an okay
Okay.
from you ever.
That was
Like,
the most appropriate answer I could
yeah,
give in that
that was like
moment.
the first
That was
ever.
me having a filter for the first
Yeah,
time
yeah,
ever.
first time ever, honestly, because I've never been met with an okay. Yeah. So, but anyhow, so that's an interesting survey. Obviously, size matters. And so, what happened is in February 2024, and we do a lot of regenerative procedures for, erectile dysfunction. And again, when it comes to size, you're a little more limited because there's been a lot of, talk around vacuum erection devices. And if you haven't seen our other video, checking that out on vacuum erection
Mhm.
devices or penis pumps and size, but there's not a lot of studies supportive that.
Just like with filler.
Correct. And so the medical treatments for
Yeah.
it would be filler, which can be used fat transfers.
Yeah.
And, there's some, again, at home type of things that men will do. And so that's more of
Which
a
sound terrible.
penis enlargement or PE type of things that they can do at home. So fillers, a medical treatment, you can do fat transfers, and you can even do silicone augmentation. And of course, there's the extreme of suspensory ligament
Yeah. So
surgery that
surgeries
you
where they
hear
cut.
a little bit about. I don't know that I've seen urologists actually talk about
Sounds
performing it.
terrible.
Yeah.
Look that up. Don't do it.
No, the reports are definitely not in favor of ever using that as a way to get enlargement. And again, but the manuals, like the things that they do from at home, is manuals like traction devices, suspensory devices, but vacuum erection devices seem to be the most common. And
And it
again,
sounds the least painful.
yeah, the least painful, and it's actually men. Like when they talk about it, they report, maybe a 1, 2, or 3% increase with that. And again, the studies and science don't necessarily support that. But now there's an interesting study that came out in February of 2024 in the Journal of Sexual Medicine, and it was Dr. Runnels and Dr. Brandi. And again, it was a small study, but still, it was a study that talked about PRP injection into the penis. That can be known as the P shot if you're, in a group with Cellular Medicine Association and doing those and working within that, group to provide
And then
it
this
in a
study was
standard
men
fashion.
that had no previous issues, no
No
previous
previous treatments.
treatments.
Yeah.
So I think that's always important to kind of know the baseline.
And they were 30. The average age was 30. And
So
so,
young
right.
guys.
Yeah. And there was, 20 to 55, average age of 30. So, yes, no, previous treatments, no issues like as curvature, nothing that,
Medical
um,
diagnosis, nothing
correct.
that would cause any issues. So just guys
Yep.
that wanted to change
Yeah.
length and girth.
Yep. And they did a standard measurement. And again, they did pictures as well, images, so that you could see that. In baseline, they talked about again an average length of 5.75 and girth was 5.25. And, again, if you look at like that average length and girth, it, is variable in what you see, like 5.5 being length, 5.1, I think, girth. So there's, but I haven't seen a really solid across the board because again, it
Mm.
varies per country. There's lots of different reports on that. But for them, 5.75 length, 5.25, and improvement in both. And so, but
And this is just PRP.
just PRP. So just
So
PRP
no
and not,
shockwave
nope,
therapy, no pumping, no vacuum
just
erection devices,
one
just one
treatment
treatment.
with PRP injection. They did use ultrasound guided injections again into the corpus cavernosum. Is not that hard, and I didn't look at the technique to see if they did one injection or multiple injections. And then again, it's PRP, so it's your own blood and you're using the growth factors from your own blood, so it's safe. There's no reported adverse effects with, obviously PRP from a long
Hmm.
term standpoint. Of course, anytime you put a needle in something, you could potentially get bruising or
Some
swelling,
bruising.
or so that's common, but again, nothing long lasting. And and no other injections with it, but just the PRP. And again, it worked. So length was up by zero point 0.8 and girth was up by 0.47. And so again, there's a graph that kind of shows that that might actually project out to being bigger gains with repeat procedures. So it's a very, I guess, like it's small, but again, you're looking at something that does involve a foreign object, an injection of filler, it doesn't require a surgery. And again, the traction devices or penis pumps are great home, ways to potentially do this, at least based on a lot of forms of men.
Mhm.
Not a lot of study support of it necessarily, but definitely helps with ED if you're at an older age. But again, this is a great study for one procedure in office with no side
That's
effects, and
regenerative.
and
That
that's
doesn't involve
regenerative.
cutting.
Yeah, and actually, all of them had improved in function. So we saw improved length, improved girth, but also across the board, every single one of them had improved function. So that is good news because then again, you get all of it and it's regenerative, no pain, no downtime.
Now, think if you add that with regular pumping and you add that
Yeah.
with other treatments like shockwave therapy to help with blood
Mm-hmm.
flow. It'd be interesting if Reynolds did a follow up study with those same type of men,
And
same
then
age,
added,
same precursors, and then added
yeah,
treatments.
yeah. There are all kinds of, potential studies to show those regenerative treatments work. And again, acoustic shockwave, certainly we have another video that you can watch that talks
Mhm.
about that with all the science related to that.
We've also done
And
very in depth videos on platelet rich plasma for the
yes,
P shot.
that,
So if you're interested in learning more about that procedure, please feel free to look at our video.
yes, we'll link some of those in the description. So please share if you've ever had a P shot and or a PRP injection, which again, we, go by P shot in our office, then let us know your experience with that.
Or
And
if you've had surgery, or if you've done any of these
yeah, yeah,
other different modalities, did they work?
yes, because it seems across the board that
It's,
men are happy with filler
yeah.
and seems to be a very popular, addictive, no pun intended, type of procedure. And so let us know about that. So if you're doing stuff
Mhm.
at home, manuals, you're doing the vacuum erection devices, you've had filler, fat transfers, let us know. And of course, the surgery would be very interesting just to
I
see
want
if
to know
anyone's
all the
had it.
comments,
Yeah.
guys. Like, I really want your participation in this. Like, what actually works? I was on Reddit, I read a lot of the comments, and it was eye opening
Entertaining
and
too for you.
entertaining, but it was
Yeah.
eye opening what some men are
Well,
doing and what devices they're utilizing to try to improve
yeah.
and to enhance. So please comment.
And we're here to, again, we learn from you. We're here to learn from you. We want to provide the best and most comprehensive
Mhm.
services. And why it's entertaining is men in their comments back and forth between each other is actually probably the most entertaining part
Enlightening.
of it. Yeah. Yeah. So,
Enlightening.
but anyhow, like, subscribe, share with friends. Let us know what you want to hear more about. And then again, let us know your experiences because we're here to deep dive into anything sexual wellness.